Today we will discuss ALL, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Let's break down ALL. It stands for acute lymphoblastic leukemia, or interchangeably acute lymphocytic leukemia. What is it? Imagine your body has a factory of workers who keep your body running smoothly. And these are your normal blood cells. However, with ALL, we have defective workers who are taking up space and preventing the good workers from doing their jobs. And these are the lymphoblasts, which appear in this condition known as ALL. Because you don't have enough healthy blood cells, you can experience a variety of problems. How to know if you have it? It's important to remember that these symptoms can also be caused by different types of less serious illnesses. So if you experience many of them, or if they persist for a long time, you should absolutely consider getting a proper diagnosis. Common symptoms include fatigue and weakness, frequent infections, easy bleeding and bruising, bone pain, swollen lymph nodes, fever, loss of appetite and weight loss, night sweats, shortness of breath, and skin rashes. Important considerations. See a doctor. If you're concerned about these symptoms, the most important thing is to see a doctor. They can perform blood tests and other examinations to determine the cause of your symptoms. Diagnosis. This disease is diagnosed through blood tests and bone marrow biopsy. It is very serious, but with modern treatments, many people can achieve remission, meaning the cancer is no longer detectable. In short, it is a type of cancer where your body makes too many abnormal white blood cells, leading to shortage of healthy blood cells. This can cause fatigue, infections, bleeding, and other symptoms. Here's what usually happens if someone is diagnosed with ALL. They see a doctor, specifically a hematologist or an oncologist. They receive treatment, and that would most likely be chemotherapy. There is the induction phase, and the goal is to kill most of the leukemia cells in the blood and bone marrow, putting the leukemia into remission. There's consolidation and intensification phase of treatment, which aims to kill any remaining leukemia cells that may not be detectable. Other treatments include stem cell transplant, which is bone marrow transplant, or targeted therapy. Some newer drugs target specific proteins or pathways in the leukemia cells, or immunotherapy, which helps the body's own immune system fight the leukemia cells. Supportive care. Managing side effects caused by chemotherapy, such as nausea, fatigue, and hair loss, as well as an increased risk of infection. Blood transfusions. If blood counts are low, this would be needed. Antibiotics to treat infections. Nutrition. Eating a healthy diet is, of course, very important to cope with this treatment. Follow-up. Regular checkups are needed. And these are important to check if there is a relapse. A relapse simply means the disease returning again after most of it was gone. Let's simplify what happens in the hospital when someone has ALL. They confirm the problem by running tests, blood tests, and bone marrow tests. They start killing the bad cells using chemotherapy. They protect from the problems by doing infection control, blood support, nausea control, nutrition. So they provide many drugs to counteract the negative effects of chemotherapy. Special treatments such as stem cell transplant, immune therapy, or targeted drugs may be considered as a second line. Lots of support from social workers and family support is provided. Here are some common medications used in the treatment of ALL. Chemotherapy drugs, vincristine and daunorubicin or doxorubicin, L-asparaginase or pigasparagase, cyclophosphamide, cytarabine, methotrexate, mercaptopurine, prednisone. Targeted therapy drugs include imatinib, dasatinib, nilotinib, ponatinib. So the ending is tinib. Supportive medications, anti-nausea such as ondansetron, antibiotics such as vancomycin, antifungal medications such as fluconazole, antiviral such as acylclover or valcyclovir, growth factors such as filgrastim or pegfilgrastim. It's important to consider treatment protocols, individualization and side effects. The dosage and the duration of these treatment methods are very different for each patient depending on how aggressive the cancer is, and this is why you would need a specialist to determine what to do next. Who might be at a slightly higher risk of developing this disease? Kids, especially between the ages of 2 and 5. People with certain genetic conditions like Down syndrome. People exposed to high levels of radiation, or people with a sibling who has ALL, or have had past chemotherapy or radiation for a different cancer. Certain ethnic groups, such as white people, are also more prone to this condition. Risk doesn't mean guarantee, but most cases also have no known cause, unfortunately. So we should focus on prevention and early detection. There are many things that can increase the risk. However, ALL is a rare disease, and most people who get it have no obvious risk factors and are absolutely not to blame. Now you need to watch my video on rhabdomyolysis or have a look at pneumonia.